Energy equity is access to affordable and efficient energy, or what you might consider your utility bill. Furthermore, health equity involves access to education to prevent disease, but also reliable access to healthcare and services needed. My name is Anya Moore, and I'm a fourth-year student doctor here at St. Louis University School of Medicine. Energy Care and I have created a community partnership providing weatherization services to vulnerable, underserved, lower socioeconomic populations in St. Louis. I'll be presenting on how the weatherization services and decreasing your utility bill can cause significant improvements in your physical and mental health. Quality holistic healthcare and services address physical, mental, spiritual, and social needs for the client. Studies have shown that citizens of lower income status are 3 times more likely to die early. The charts above demonstrate how much of an effect social determinants of health have on your lifespan. As you can see, the second to smallest contributor is access to health, and the largest contributor is your personal behavior. Dealing with the realities of thermal stress, like stress secondary to discomfort or extreme temperatures, diminished air quality, or worsening comorbidities, will cause you to bargain necessities and make sacrificial decisions in the face of scarcity, uncertainty, and disparity. But Green and Healthy Homes Initiative characterizes this social inequity as a health disparity that is unfair because it's not equity, unjust because it's not morally right, unavoidable because it's a systemic trap of oppression that lower income families fall into, and unnecessary because we could all win if we agree to change. Hope lies in the fact that disparity is neither inevitable nor unremediable. This is where weatherization comes in to mitigate the impacts of these social determinants of health. Weatherization provides environmental, economic, and health benefits while also restoring education, empowerment, and autonomy for our clients. The American Council for Energy Efficient Economy defines energy burden as a total annual utility spending as a percentage of your total annual gross household income. Their studies have shown that the median United States energy burden across all cities in the sample was about 3.5%, while the low-income household energy burden was more than twice as high at 7.2%. Some of the causes of increased energy burden that we address are inefficient HVAC systems, poor insulation and air sealing, chronic economic hardship, and many others. We provide free, sufficient, and accessible weatherization and education to change those behavior drivers listed. As you can see on this list of outcomes, outside of worsened health outcomes, this ongoing cycle of poverty truly creates a scarcity mindset for lower income people, leaving them in fear that there will never be enough. The Council makes note of outcomes that resemble minimal survival, not quality of life. Our city's energy burden is disturbing. For low-income families, energy burden ranges from 7.2% to numbers as high as almost 15% in some homes. We rank top 10 for low-income homes, African American homes, and rental homes. The presentation can be paused at any time to take a better look at the results of the study. However, take a look at the chart on the left. Lower-income families are followed closely by African American families in ranking for highest energy burdens. And sadly, as of March 2020, our city has no energy reduction goal. The segregation and complacency of the city is unremarkably failing our St. Louis residents and robbing them of energy equity and health equity. Green and Healthy Homes Initiative exemplifies here how home interventions of weatherization can truly improve housing conditions and thermal stress. On the left, you'll notice replacing HVAC systems has been most effective for reducing hazardous toxins, dust mites, mold, and bacteria. Early exposure to these allergens can compromise infant respiratory systems or their lungs and cause respiratory infections and worsen asthma symptoms. This results in decreased asthma and allergy symptoms, respiratory illness, and hospital visits. As you can imagine, this improves environment, education, and social determinants of health and health equity for our clients. On the right, thermal stress improved with insulation, decreases heat seepage, and reduces heart and vascular disease, decreases hospital visits, ultimately providing better health care and quality housing. Weatherization is also allowing for substantial monetary savings and reduced medical costs. Now, in the following charts, you'll see the current health outcomes of St. Louis and why not worsening the problem is important. The VAST study was conducted by Washington University and St. Louis University, titled For the Sake of All, and published in 2014. It gives us a clear view of the health inequity and disparity experienced in this city. The orange shows percentage for Black adults and the gray for white adults. Black St. Louis residents have higher prevalence of asthma in the city and county. All other comorbidities can be worsened due to the effects of thermal stress and toxins on the body. In St. Louis, cardiovascular problems, asthma, and COPD, or lung disease, are leading causes for hospitalization in Black populations, while for ER visits, you can see similar results: cardiovascular, asthma, and COPD. If we reduce the disparity in chronic diseases like heart disease, cancer, and diabetes, St. Louis could save $65 million a year in inpatient hospital charges, which would be a significant cut in the $1.1 billion spent on just these three diseases alone. As for death rates, cardiovascular disease and lung cancer are the leading causes for chronic disease and cancer deaths in Black people in the city of St. Louis. Both multifactorial, but weatherization interventions do improve both health outcomes. And not only are mental health disorders perceived as weaknesses, but the mistrust in the healthcare system keep Black people from seeking the treatment needed. Even then, ER visits for mental health conditions for Blacks in St. Louis are 121% higher than white people. Black people make up 30% of the population here and make up 42% of the yearly mental health charges here. That is astounding. Asthma, mental health, and poor school performance all contribute to the rate of high school dropout. Repeat respiratory illnesses have the potential to increase hospitalizations, emergency visits, missed school days, and lower grades. This opens the door for substance abuse, unplanned pregnancies, and even early deaths. On the right, you will see that the asthma ER rates, or emergency room rates, for African Americans are 7 times higher than white children. WashU and SLU report that asthma is not only the most common chronic childhood illness, but it disproportionately affects low-income, racial, and ethnic minority children in urban areas. As we approach the winter months, we expect a very unpredictable pandemic and influenza season. Renew Missouri found that weatherization is important because, due to the pandemic, vulnerable populations are spending most of their time in their homes, whether it be because of virtual schooling, virtual events, work from home, quarantines, etc. Simultaneously, unemployment has skyrocketed, leaving many people without reliable income and forced to bargain between important necessities. And then, despite utility responses to the pandemic, more people are disconnected and utility debt has mounted for those classified as low income and unemployed. And as stated before, that debt is piling up and piling up. And the utility disconnection only leads to evictions and forced mobility, people having to move out, and that leads to decreased health and education for their children. In the publication titled Recovering from the COVID-19 Pandemic, clients are facing multiple disparities, including older adults having harder time re-entering the workforce, losing retirement plans and savings, disruptions in the usual services that they received, isolation and anxiety causing diminished mental stability, and older adults are at increased risk for physical and economic challenges caused by COVID-19. If you notice the charts to the right, they present with the COVID-19 demographic data for St. Louis. You notice that the cases are by race, age, along with death rates. In case you were wondering, wintertime is not the only time where thermal stress can become a problem. According to the CDC, countries in the darker red shades have had the greatest increase in heat wave deaths from 1979 to 2016. St. Louis is one of the top cities suffering from increased hospital admissions and heat wave deaths secondary to heat stroke, cardiovascular disease, respiratory disease, kidney disease, and stroke. Furthermore, client projections are indicating that extreme heat events will be more frequent and more intense in the coming decades. This is a worsening issue. On the right, you notice that the increase in hospital admissions is worse in Midwestern states compared to Southern states. We are in the Midwest. And this is because people are not expecting extreme heat, and many homes lack adequate air conditioning. In the graph, Missouri is a red state, meaning 4 out of every 100,000 people are being admitted into the hospital for something as simple as the temperature in their homes. Climate change will increase thermal stress and significantly impact health outcomes. At the end of the publication, WashU and SLU provided recommendations to improve health equity to the right. So on the left, we respond to those recommendations with energy equity. That means we invest in early childhood development by decreasing those asthma comorbidities and missed school days. We're expanding economic opportunities by decreasing energy burden and the cost of utility bills. We're improving mental health by decreasing thermal stress, scarcity mindset, and sacrifices made by lower socioeconomic communities. And we're enhancing neighborhood housing, allowing for quality neighborhoods and environmental conditions. We are amending chronic and infectious disease prevention and management by allowing for increased personal funds for access to healthcare, therapy, and favorable health outcomes. Chronic disease affect our economy in multiple ways. Healthcare spending, decreased productivity, weaker businesses and economy, missed school, missed work days. We just need a healthier city, and we need to save on healthcare spending and create a more productive local economy. And this slide shows exactly how we can do that. So at Energy Care, this is what we do. We are actively advocating for families throughout the St. Louis region, city, and county year-round. We have hundreds of volunteers from churches, schools, universities, and corporations. Most agencies have wait lists for clients, but we realize the importance of urgent service, and we are partnering with other programs to serve our clients holistically. So again, I am contributing to Energy Care's platform by conducting health programming around social determinants of health and the relationship between weatherization and health outcomes. I am building a referral program, virtual wellness checks, and conducting surveys to measure health outcomes, client comfortability, client perceptions, and home satisfaction before and after weatherization. The goal of this presentation was to demonstrate how weatherization and energy efficiency interventions can effectively mitigate detrimental health outcomes. These smaller scale techniques provide efficient heating, ventilation, insulation, air conditioning, and air sealing that changes lives forever. Our client testimonials prove how we are changing lives of the most vulnerable free of charge.
100 degrees in my house, and I didn't have any air. Yes, it does. I feel so much warmer when they come out and put the plastic, just like they just put this plastic over this window right here.
Energy Care has not only helped me, but a lot of other seniors.
Energy Care all the way, saving lives by degree.
And to volunteers, we thank you guys.
Always gotten back with me and asked me what did I need, and they've always supplied that.
Please don't stop doing what you're doing.
Everyone that I've talked to about Energy Care, they were satisfied with their work.
How it gives the person a little bit more hope these trying times now. The help is really needed.
So by degree and degree, step by step, we're all satisfied. Thank you very much.